Hello, and thanks for joining us today. In today's segment, we will examine the important role of exercise in people with diabetes. I am Chuck.
I'm Chris.
And I'm Teresa.
Exercise. Reminds me of a quote attributed to Mark Twain, who said, "Every time I get the urge to exercise, I lie down until the urge passes away." Well, Chris, we all know this, but why is there such a reluctance?
I think the top true reason of reluctance, one, I hate to say it, but it's laziness. Just pure, utter laziness.
Very
and we've
true.
all suffered from that. So I don't want anybody out there thinking that we're
We're all guilty.
Yeah. So truly, we all view exercise as a work. And when we view exercise as work, truly, work is no fun. None of us think of work as being fun. So truly, there's a misconception that when you exercise, you have to exercise so much that you have to sweat and work it out. But that's truly not the case. You can get benefits from exercise without doing that. And truly, another reason is finally people do not believe that they can keep up with the long haul of exercise. And this reluctance leads to recidivism in the long run. So they'll start something and they'll do good and then they stop. And that's the problem. And truly, we also need to understand that it is truly quite amazing how and why patients really can't devote 20 minutes a day for 24 hours of their day. Just 20 minutes, 20-minute time frame. If they would just do that, it would be so awesome.
Maybe it's the fact that people connect exercise with losing weight. And when people try to lose weight, they don't see the results immediately. So they feel like they can never exercise enough to lose weight, and they ignore to exercise because they don't think they're gaining anything.
I think that's a very important fact, because we need to understand and tell our patients that regular exercise has so many benefits that are independent of losing weight.
So truly, if that's true, so what truly are some of the benefits that we can explain to a patient and people with diabetes of how does exercise help truly control their glucose level?
That's a very good question, and let's count some of the ways that it helps. First and foremost, exercising our muscles lowers blood glucose by helping our muscles siphon or suck in the glucose into the muscle to make energy.
Well, that's a good way to think about it.
And second, it reduces the percent of body fat, even though you might not have lost a lot of weight. And as we all know, the more fat there is, there are metabolic consequences to that. Third, exercise always helps us digest food. How many times we have heard our folks tell us, don't eat and lie down, go walk. And finally, more importantly, it makes you breathe better and has a positive impact on sleep pattern, stress, and overall well-being.
Wow.
The next level when you exercise is, other than weight loss, is you have the reduction of belly fat or visceral fat, otherwise known as the bad fat, which predisposes us to the heart disease. And we don't want that for sure. So, and it's nice to exercise. You have those endorphins, which make us feel really, really good when you do aerobic exercises.
Like what you tell me, go take a run, Chris, so you'll feel better.
And endorphins always make us feel good about ourselves, and it's always nice to have some of those.
Truly. And really, truly, this is a lot of these activities that you're talking about, Teresa, can be incorporated into our daily life. And that's something that we need to understand. Just 30 minutes a day of a nice brisk walk 5 days a week truly has an impact on our A1C. Did you guys know that it can lower it by at least 1%?
And we don't all have to do it all at once at 30 minutes.
And Teresa, you reminded me that there's a bunch of apps that we can get on our phone, and I want everybody to know there's apps so you can do the Fitbit. You have I have an Apple Watch. Any of your phones have apps that you can keep track of your exercise. So we'll list a few of those at the end of this program.
And I just want to point out that 1% A1C drop is like going down from 12 to 11. It's big. It's just not 1% out of 100. It's 1.A1C,
Absolutely.
which is great.
And I talked about going from a brisk walk, but when you go from a brisk walk to that next level, that's really jogging. And really the benefits there are even better. And there's other activities such as swimming, bike riding, dancing, Zumba, yard work. Believe it or not, yard work, Teresa, I'm not going to get rid of the landscaper. And truly, of course, joining a gym. If we join a gym, we can use those machines such as the rowing, the recumbent bicycle, the regular bicycle, the treadmill. All of these truly are ways to dispose of that glucose effectively. And that's really what it's all about.
Well, it seems like compared to so many other therapies, exercise is most safe and it's quite physiologic. However, it is always good to check with your healthcare provider if exercise is safe. You shouldn't be a weekend warrior where you do nothing for 5 days and then jump into it. You also should avoid heavy impact exercise when you're a beginner and you're starting. Gradual build-up is always good, and you need to warm up a little to get your muscles moving so that they can go faster and better. And it's also important to check your blood glucose before starting the exercise. No provider can predict for you what you're going to do with a certain exercise, but you can check it before and you can check it after. And of course, the most important thing is to get hydrated, carry water. And is there a good time, Teresa, to exercise?
Well, any time is better than no time.
True.
It all depends on the person. Really, it does. Most people start their day with exercises. That's always a good routine because they have a lot of energy, they're ready to go, because usually by the end of the day, they're tired, they're pooped out. All they want to do is go eat, go to the couch, then go to the bed. So I know how that feels sometimes. And you got to remember, heavy exercises after a meal is not a good thing because the blood flow goes directly to the GI tract, which promotes digestion, nausea, vomiting, gastritis, GERD, which is not fun to have.
So you're trying to tell me exercise can lead to feeling like you're going to throw up?
If you do a heavy exercise right after you eat, definitely. However, a 20-minute walk after dinner, when the weather is down, it's nice and cool, might help a long way with the spikes in postprandials, the 2-hour post sugars. The timing and the routine is based on what the person wants.
And you hit the nail right on the head by emphasizing routine. And there are several studies that indicate that a very simple thing as walking briskly for 30 minutes daily for 5 days in a week is a good way to decrease insulin resistance, which we all know and keep talking about it as a core defect in type 2 diabetes. Also, improved insulin sensitivity allows your body to utilize your own insulin in a more efficient manner and bring down the glucose gently.
So I guess there's something I have here. Taking that concept one step further, if we think about that, given the cardiac risk factors of diabetes, would improving insulin sensitivity favorably impact heart disease and diabetes?
That's a very important question, and I think the answer is very definitely so. In fact, telemetry after having a heart attack is to actually promote the beneficial effects. In fact, recent research indicates that mild to moderate regular exercise, regular exercise, for 1 month increases the release of a signal molecule called nitric oxide that relaxes the blood vessel, including those that supply the heart. So those tense, kind of constricted muscles tend to relax with a simple, brisk 20-minute
But
walk.
my question for you is, for people who can't walk, they can exercise in their chair
Get
with their
move.
hands, move as long as they
So
move
chair
their hands.
exercises.
Chair
Absolutely.
exercises, because lifting cans with the hands, your hands get a little tired.
And we talked about this as being work, but what I'm hearing, doctor, is truly it looks like exercise is relaxational for the heart, the body, and the mind as well. Is that true?
I think that's true, yeah.
So what about patients with diabetes or those that aren't obese and maybe have type 1 diabetes? Would they truly benefit from exercise as well?
Definitely. The blood glucose benefits people with diabetes because it helps those no matter if they're type 1, type 2, what stage they are in, or any of that. Exercise definitely helps. People with type 1, it demonstrates the same benefits of exercise, and it helps reduce their blood sugars because it helps the insulin work better.
So you're telling me that type 1, type 2 get the same benefit. So why does everybody always out there acting like, oh, type 1's different than type 2? Is that, I'm hearing that it's not that. Is that true?
You would get the same benefits.
That is true.
Because the skeletal muscle is a great utilizer of glucose. So when you exercise, it improves the muscle's functions, and the endogenous glucose is moved efficiently across into the muscle.
Wow.
And this improves insulin sensitivity, which means the liver produces less glucose, and decreases the pre-meal blood glucose levels.
Wow.
So that will help all together.
Truly, wow.
So, Chris, can this become too much of a good thing and pose a danger of dropping the blood glucose precipitously, resulting in having to call 911 when you went to the gym?
It sure can. And truly, in such patients with diabetes, you've got to make sure that you know that if you exercise too much, your blood glucose can decline greatly or in a very short period of time. So really it depends on several factors. The blood glucose level prior truly to exercise, the degree and intensity of the exercise, adequate hydration. You touched upon hydration earlier, and the individual's response. Remember, each one of you are different. And so it's your response. It's not what we say it's going to happen. And like you said earlier, the provider cannot adequately predict this. So you have to do some homework out there. And truly, it's a good idea to check your blood glucose before starting exercise. Remember, if it's 80 milligrams per deciliter or less, you need to not start exercising at a very high level. You need to correct that first and then start exercising maybe at a slower level and work your way up and get into a more intense exercise when your blood sugar's a little higher.
I think this is a very good point, because some of my patients have said, oh, I do not want to exercise because I am afraid that I might go into hypoglycemia.
But this is where you have to understand that walking, just a little walk, doesn't always affect the blood glucose that much, but it's still exercise. And remember, you have to have an idea of truly what the degree of your blood sugar is going to happen either before, during, or after exercise. So you need to be able to quantify that so that you can tell us, the provider, or your healthcare provider, exactly what exercise is doing to you, so we can kind of guide you in the right direction. And truly, in a way, this is no different than checking the post-meal blood glucose. You have to do it after you eat meal because we want to know what the choices and consequence. Truly, what's the choice of your exercise and the consequence of your exercise? So that's what you're going to do. You're going to be checking sometimes before, during, and after.
And that's a good point, because some of the very sensitive individuals, like people with type 1 diabetes, this can abundantly happen within minutes. So it's good to check before and follow the trend.
Absolutely.
Just like you pointed out with food.
Definitely, because I know when I exercise, I have to drop my basal rate because I drop dramatically. It's crazy. But I've heard that some people's blood sugars go up. Is that true?
Yes, it is true, and it is not that common, but it can happen. And one of the reasons for that is we see this in individuals who are exercising strenuously. And when you do that, your body is releasing adrenaline. That's why your heart rate goes up, you're perspiring, there is an adrenal pump that is working. And unfortunately or fortunately, adrenaline takes glucose out of the liver. It mobilizes.
So this is the same effect that when somebody has low blood sugar and they get that high heart rate and they feel sweaty and shaky, that's adrenaline. They get the same thing.
Now you're doing this on account of the muscles that are pumping.
Wow.
And as a result of this, you might mobilize enough glucose out of the liver to increase the blood glucose level. But the key point is it is temporary. It does not impact on your glycemic control overall. And actually, if you wait it out in an hour or two, it completely normalizes without your doing anything.
Wow.
You don't have to take insulin for that. And it certainly has to do with the intensity. Also, it's good to have fluids on board. And that minimizes the risk of this increased blood sugar level. On a related note, what would you recommend, Teresa, for people with type 1 diabetes on a pump?
Well, I would say I would test your sugars before, even during, and definitely after, because that depends on what type of exercises you're doing, how much you're going to drop. And clearly, hypoglycemia has to be avoided and evaluated. So there's different types of exercises will make a difference. And the caloric expenditures varies with the type of exercise.
So you're telling me calories are important here too?
Definitely, definitely. Such as when you swim, it takes more calories loss, and then you have more energy used than Zumba dancing. So that makes a big difference.
So swimming, you're telling me swimming uses more than even Zumba?
Yes, definitely. Wow. And the key here is to avoid hypoglycemia, avoid those low blood sugars. And if your blood sugars is less than 80 during your exercise or after you exercise, suspend your pump or take a little snack afterwards or during it.
Wow.
That's very good advice. What about some of the signs to watch out that indicate that the intensity of the exercise has become too much?
I think moderate endurance exercise, and most people would agree with this. Truly, you would expect your heart rate to go up a little bit. You'd feel a little warm, and you'd sweat a little bit more. But it's not uncommon to truly breathe a little faster during this time. However, there are some signs to watch out for. If you get chest pain, pain behind your breastbone, if it takes longer than 30 minutes to recover, if truly you're just extremely tired, and you can't recover, what you have to think about is maybe there's some heart disease. Another thing is if you get calf pain, maybe you're on a treadmill and you get severe calf pain all of a sudden after you stop exercising, that could be like an intermittent claudication, peripheral vascular disease. There might be some poor circulation in your limbs, so you have to really be thinking about this. That's why they always say check with your healthcare provider before you start an exercise program.
And remember, you're doing a stress test on yourself.
It is. It's kind of so,
Yeah.
especially on the treadmill if you get chest pain.
So I like to remind people of a mnemonic called FIT, F-I-T, frequency, intensity, and time. Those are important for each person to know what are your limits. And we have so far looked at all the advantages of regular exercise. True. Despite the many benefits that we have all talked about, I still encounter patients who will not agree to make this part of their routine treatment plan. More and more studies are indicating that moderate regular exercise actually will have a larger impact even than losing weight in the long run. So when the two are combined, moderate lifestyle modification with exercise and nutrition, the benefits are exponential. So what can we do for these patients who do not want to move?
I think the hardest part is get it started and stay motivated to continue.
True.
To stay with it.
We've all been there, haven't we?
Definitely. So there's little things you can do. You can park your car a little further, and you don't have to wait for the first spot in the front. You can take the stairs other than the elevators or the escalators.
Well, you can run up that escalator, huh?
Good move.
And if you have a sanitary job where you just sit around, get up once every hour.
Is that
half an
sanitary?
hour,
Is
and
that
stretch.
sanitary or sedentary, Therese?
Oh, did I say a job that just sits around and plays with the computer, which many job does. And then when you go home, walk your dog. Our neighbor even walks her cat. Just walk out, get out there. And you have you, yourself, and your dog and your cat that will love you forever. So take care of yourself.
So like your best friends, huh?
Definitely. And then what the sad thing is, a lot of people who are obese won't go to a gym because they see all these thin people with a six-pack, all those muscles. But remember that you need to go to the gym not for what you look like, but it's for your health. Definitely.
Well, that's a good point. Wow. It's for their health and not what they look like. So throw vanity out the window.
Definitely. Throw it out.
Wow.
Well, that is very well put, and that's a very important point you raised. So I'll end with another famous quote. Those who think they have no time for exercise will sooner or later find time for illness.
Wow.
On that note, we thank you for joining us. I am Chuck.
I'm Chris.
And I'm Teresa. Please don't forget to give us your feedback. And please like, comment, and subscribe. We love hearing from you, and please feel free to email us. And don't forget to visit us on Facebook, Instagram, and Twitter, as well as our website. Thank you.
Thank you.
Thank you.